Ashley. I am just going to do my video validation for removal and insertion of Foley Cath and also the specimen. For my catheter, I already checked my patient and performed hand hygiene. I also have exposed the patient. Normally you would want to keep him covered, or her covered in this case, for as long as possible. So I'm going to start by pulling back my stuff, only pulling from the corners. This is a sterile field. Grab my glue, grabbing from the shiny side only. This is what I'm going to tuck underneath the patient's perineum so that they can stay sterile right underneath the patient. Just grabbing the shiny side. And this would still be sterile because this end has not touched anything. Going to remove this. This would be to cover the patient. That's mostly for males, but in this case we will not be using it. Okay, now I'm going, since the patient is ready and prepped, I'm going to don my sterile gloves. In my pack here, I've got my iodine sticks so I can cleanse the patient, and also my water to prep the balloon, and my lubricant for the end of the catheter. So once I've got my sterile gloves on here, so now that I have completely sterile gloves, I'm going to take my pack and separate it. Take this, set it off to the side. That's for a specimen later. I'm going to open up my iodine swabs. For the case of the mannequin, we won't actually be using the iodine swabs, but they are going to be out and ready so that treating it as if it was a real patient so that we can get that patient sterile to prevent infection. I'm going to throw this off to the side because this is garbage, and I still have my hands sterile. Now I'm going to open my lubricant. Disposing of any garbage, just throwing it off to the side. Also, for the sake of the validation, I won't actually be using the lubricant. So now that everything is all prepped, I'm going to prep my balloon for the insertion of the catheter. Just going to pull back the plastic a little bit, keeping this end as clean as possible. We don't want it to flop out. I'm going to insert about 10 mils of normal saline. Making sure that inside the plastic here keeping it together. Inside the plastic here, I want to make sure that the balloon is inflating so that the catheter is working correctly, so that once we inflate the balloon inside the patient, that it will work. And that did work. Now I'm just going to set that aside. So now both hands are still sterile, but this hand I am now going to contaminate. Actually, I'm going to take this plastic off here first. Actually, just gently laying that end into lubricant, maybe. Okay, with this hand now I'm going to pull out this apart so that the catheter can be inserted correctly. Now, with your iodine, you want to go down one side, don't cross the sterile field, throw away. Take the second, go across the other side, don't go across the sterile field, throw away. And with the last, same thing, just going down the center. So now that your patient is completely clean, you're going to grab the tip of the catheter about 3 inches up, put it into the lubricant, which I'm not actually going to do for the sake of the video validation. I'm going to go about 3 to 4 inches up until I see urine return. Now that I'm seeing urine return, I would go up 1 more inch. And a good way to measure that is just put your hand an inch down and then insert up to the finger point. So now once that is done, you don't have to worry about keeping the field sterile anymore. So I'm going to attach this. I forgot a very important step. So after I was done with that, I would keep this clamped because the urine is returning. Keep this clamped, and I would insert 5 milliliters of water into the tube so that the balloon is full, so the urine doesn't keep leaking out and that the catheter stays in place. That would be done before I would attach this and before I would contaminate my hands at all. You got to keep that clamped and put that water in there. So once the balloon is there and filled, you would properly attach this to the leg with this right where it bows off there. And then take this out and hang it on a non-movable portion of the bed for the catheter to be drained correctly and not get tugged on at all. And right after you would fill that balloon, you would tug it a little bit as well in here, very gently, just to make sure that it's going to stay, the catheter is going to stay in place and the patient isn't going to leak that at all. So then once that's done, you can cover the patient and clean up your area. Now that the lab has called, or not, for the sake of the video validation, the lab has called and we will be doing getting a specimen for the lab. So I'm going to re-uncover the patient again. You want to have your lab products ready. So I still have this came out of my catheter pack earlier. When I take the cap off, I want to make sure when I take it off that I remove that cap lid and keep it down. Don't want to contaminate anything, and I also would have got new gloves and washed my hands after the last procedure. now the patient is ready, I would take an alcohol swab and do the top of this port so that you're not contaminating anything. Remove the cap. Remove the cap to my needle and insert after aspirating. And then I would draw back. For the lab, you only need 10 mils of urine. Then I would take off. Put my specimen in my lab container. Insert. Cap my specimen bottle. I would sign, date, and label, and there was also a label included in our catheter bags. So at this point now I have doctor's orders to remove the catheter. So now I'm going to prep for that. Doing the basic steps of checking the patient, making sure you got all the right orders, getting your last I&O input from your bag. This would go into the sharps container from your specimen removal. Then I want to make sure that I have something here to catch any extra urine. You don't want to make the patient uncomfortable so it looks like they wet the bed or anything like that, even though our bed is always already a little bit wet. Okay, so then I want to get the syringe that I have after I pinch. Okay, so with the syringe that I accidentally threw away already, with this syringe you would check your notes and make sure from the nurse who put in or yourself how much water was put into the balloon. You need to make sure that all of that balloon is completely empty from the water. You can't have that in the patient when you pull it out, otherwise it will be extremely painful. Another good thing to keep note when you're inserting the catheter is that if it's very painful for the patient, it's not in the right location. It's in the urethra. So now that I'm removing, I'm going to stick your syringe into the port here, remove all the water that was in the balloon, dispose into the sharps container, making sure you have all the water again. And then you want to remove from the leg, making sure that everything is free and you're not going to have anything that tugs. After my bag is empty here. And then you're going to pinch off and keeping this at an upward angle. A good thing to remember about the catheter is that always keep it at an upward angle when you're inserting and when you're taking it out, to always be up, at an upward angle. And you want to just slowly remove that, keeping it pointed up. So that the patient isn't messy at all. And then you want to check the end of the catheter to make sure that it's all intact and that nothing got left inside the patient. That could be extremely dangerous. You want to cover our patient and dispose of everything properly. Then you want to go run to the nurse's station and finish all your last charting, your last I&Os from right before you inserted the catheter, what was all left in the bag, checking to make sure the patient is okay, and then you're all set to go. You want to make sure you get your lab specimen to the lab within 15 to 30 minutes to make sure that it is still good for the lab and no bacteria grows. And that is it for the steel validation.